When it comes to oral cancer, you don't need a superpower to spot the early signs. Just a little attention and a dentist who isn't solely interested in your money. Early detection is key to stopping oral cancer from wrecking your life. So let's make sure you know what to look out for. In this video, we'll cover the early signs of oral cancer. Number 10. Sores that won't quit. More than just annoying. We all get mouth sores now and then. Those little nuisances that seem to pop up right before an important date or job interview. But here's the catch. Most of those harmless sores heal within 2 weeks. If you've got a sore that's sticking around longer than your last Netflix binge, it might be trying to tell you something important. Red, white, or a combination of both, these persistent sores can also bleed easily if irritated. The key difference between these sores and a simple canker is longevity. Canker sores come with pain but tend to heal within a couple of weeks, whereas oral cancer lesions usually aren't painful in the early stages, making them easier to dismiss. Ignoring this could be like skipping a fire alarm. It's a subtle signal, but one that could make a life-altering difference if caught early. Number 9. Lumps and bumps. Uninvited guests in your mouth. Feel a new bump or lump in your mouth? It could just be a harmless quirk, or it could be your mouth's way of waving a red flag. Oral cancer often announces itself with lumps on the tongue, gums, or roof of the mouth that just won't go away. These growths might feel soft and painless at first, but as they grow, discomfort kicks in. Think of them like that friend who overstays their welcome. By the time you notice, it's too late. Your mouth should feel smooth and familiar, so if something feels off, it's time to get it checked. Remember, cancerous growths can sometimes feel innocuous, like a benign irritation, but don't be fooled by their subtlety. If they persist for over 2 weeks, make an appointment with your dentist or doctor. Number 8. Numbness or tingling. When your mouth goes quiet. Ever get that eerie sensation when your foot falls asleep? Imagine that, but it's your mouth. Oral cancer can cause numbness or tingling in the lips, tongue, or face. Sure, it could just be a weird sensation after eating something spicy. But when it lasts longer than an awkward conversation at a family reunion, it's worth a second look. This numbness can signal nerve damage from growing cancer, so don't ignore your body's signals. If your lips or tongue aren't behaving as usual, it's time for a trip to the dentist. Nerve damage might seem minor at first, but its implications can be more serious than a little inconvenience. It can be the body's way of telling you that something malignant is lurking just beneath the surface. Number 7. Persistent pain or difficulty swallowing. Not just a sore throat. Sore throats happen, especially after a concert or screaming at your favorite sports team. But when that throat pain doesn't seem to quit, and it's paired with difficulty swallowing, it could be more than just a leftover symptom from your wild weekend. Oral cancer can cause swelling or discomfort in your throat, making swallowing food feel like an Olympic sport. If every meal feels like a wrestling match between you and your fork, it's time to check in with a professional. Oral cancer doesn't wait around, so neither should you. While sore throats are common, particularly after long nights out or seasonal allergies, chronic throat pain can indicate something more severe. Difficulty swallowing, also known as dysphagia, often escalates in severity as the cancer progresses. Number 6. Changes in your teeth. When your smile gets a makeover you didn't ask for. Loose teeth are a normal part of childhood, but when you're an adult, it's a different story. If your teeth suddenly feel wobbly or your dentures no longer fit snugly, it's a sign that something's going wrong underneath the surface. Oral cancer can change the way your teeth fit together, causing discomfort and making your dentist work overtime. If you notice your pearly whites behaving badly, don't chalk it up to bad luck. Get it looked at before it causes permanent damage. The cancer can invade the bones that support your teeth, leading to increased movement or looseness, particularly if it's located in the jaw. This might seem like a simple dental issue at first, but it could be an early signal of something more sinister. Number 5. Unexplained weight loss. It's not always a win. Weight loss might sound like a dream come true for some, but if you're shedding pounds without even trying, it could be a nightmare in disguise. Oral cancer can make it hard to chew, swallow, or even taste your food, which can lead to unintentional weight loss. Losing weight this way is less summer body and more something's not right. If the scale is dropping and you can't explain why, it's time to look beyond your diet and think about your health. Unexplained weight loss often accompanies severe health conditions, and when paired with other symptoms like difficulty eating, it's a major red flag for oral cancer. Instead of celebrating the numbers on the scale, consider it your cue to see a doctor. Number 4. Hoarseness or voice changes. When your voice tells a different story. Your voice is unique, but when it starts sounding like a bad impression of yourself, it could be more than just a cold. Persistent hoarseness or voice changes can be a sneaky sign of oral or throat cancer. If you're starting to sound like you've been smoking a pack a day, even if you haven't, it's worth getting checked. Don't ignore your vocal cords. They are giving you more than just sound. They're giving you a warning. Persistent voice changes can indicate a tumor pressing against the vocal cords or throat, making it difficult for you to speak normally. When paired with other symptoms, such as difficulty swallowing or a sore throat, it's essential to seek medical advice. Number 3. Swollen lymph nodes. When your neck starts to puff up. Lymph nodes are like the bouncers of your immune system, and when they swell up, it's usually because they're fighting off something bad. But if the swelling doesn't go down after a couple of weeks, it could be a sign that oral cancer has spread. These swollen nodes in your neck might not hurt, but they shouldn't be ignored. If your neck's looking puffier than usual, it's time to call in the experts. Cancerous growths can affect the lymph nodes in your neck, causing them to swell as your body attempts to combat the invader. While not painful initially, these swollen nodes can be a telltale sign of something more serious. Number 2. Red or white patches. Not all patches are friendly. Red and white patches in your mouth aren't just cosmetic issues. They could be early signs of cancer. These patches, also known as leukoplakia, white, and erythroplakia, red, are not your run-of-the-mill mouth issues. Leukoplakia can feel rough, and unlike oral thrush, these patches won't scrape away. Erythroplakia, on the other hand, looks like velvety red lesions, and they are much more likely to turn into cancer. If you see these in your mouth, take them seriously. These patches are often painless and can go unnoticed without a thorough self-exam. The earlier these lesions are detected, the better your chances of successful treatment. Number 1. The importance of regular checkups. Don't wait for the symptoms to knock. Even if your mouth looks and feels fine, regular dental checkups are your first line of defense against oral cancer. Your dentist knows what to look for, and they can spot potential problems before you even notice them. Don't wait for symptoms to hit you over the head. Get in the habit of seeing your dentist regularly, especially if you're at higher risk due to smoking, drinking, or HPV exposure. Early detection means better treatment outcomes, so give your dentist a call before you need to make an emergency one. Routine checkups can catch small changes before they develop into full-blown cancer, significantly improving your chances of effective treatment. All right, folks, that's a wrap on recognizing the early signs of oral cancer. Remember, catching those symptoms early can make a world of difference. If you found this video helpful, make sure to hit that like button and subscribe to our YouTube channel. Don't forget to turn on those notifications so you never miss out on our latest videos. Stay sharp, stay healthy, and I'll see you in the next one.